Right now, 53 million Americans, that's 1 in 5 adults, are living with diagnosed arthritis. Another 22 million of them say it limits their daily activities. They can't open jars, they wake up in the morning and their knees ache before they even get out of bed. They stop hiking, stop gardening, stop playing with their grandkids because their joints hurt, and nobody has given them a solution that actually works without wrecking something else. The average person with osteoarthritis spends over $11,000 a year managing it. Biologic drugs for rheumatoid arthritis can run anywhere from $12,000 to $36,000 annually. The entire pain management drug industry in the United States alone is worth tens of billions of dollars and growing every single year. And yet, in a peer-reviewed, randomized, double-blind clinical trial published in the journal Phytotherapy Research, a $2 bottle of something you can find in most kitchen and grocery stores performed just as effectively as a prescription anti-inflammatory drug, with 0 side effects. And the drug had plenty. This is what we are talking about today.
The ingredient is castor oil. And before you roll your eyes and say you've heard this one before, stay with me, because what I'm about to show you is not folklore, not grandmother's remedy, and not a wellness blog's opinion. This is documented, published, peer-reviewed science that most people have never seen because there is absolutely no financial incentive for anyone to bring it to your attention. Castor oil costs $2 to $5 at any pharmacy, grocery store, or Walmart. There is no patent on it. There is no company making billions selling it. And that is precisely why you've never seen a commercial for it during the evening news between arthritis drug advertisements.
Let's start with what actually causes joint pain, because understanding the mechanism is what makes the castor oil story make sense. Most joint pain, whether from osteoarthritis, rheumatoid arthritis, tendinitis, or general inflammation, comes down to one process: chronic inflammation. When the tissues around your joints become inflamed, your body releases a class of signaling molecules called prostaglandins. These molecules are partly responsible for transmitting pain signals and driving swelling. They're also what most over-the-counter and prescription anti-inflammatory drugs target. NSAIDs, non-steroidal anti-inflammatory drugs, things like ibuprofen, naproxen, diclofenac, work by blocking the enzymes that produce prostaglandins. That's how they reduce pain and swelling. That blocking mechanism is also why, with long-term use, they can cause gastrointestinal bleeding, ulcers, kidney damage, and cardiovascular issues. The drug works. The side effects are real and sometimes serious. Now here is the castor oil connection. Castor oil is pressed from the seeds of the Ricinus communis plant. It is approximately 90% composed of a very unusual fatty acid called ricinoleic acid. This compound is rare in nature. It's almost exclusively found in castor oil. And ricinoleic acid has been shown in multiple studies to inhibit the same prostaglandin-producing enzyme that NSAIDs target, specifically COX-2, the enzyme most strongly associated with inflammatory pain. The mechanism is remarkably similar. But because ricinoleic acid is a naturally occurring fatty acid rather than a synthetic pharmaceutical compound, it does not carry the same gastrointestinal and cardiovascular risks associated with long-term NSAID use. This is not speculation. This is the published biochemistry.
Let's talk about the clinical trial, because this is where it gets undeniable. A randomized, double-blind clinical study published in the peer-reviewed journal Phytotherapy Research in 2009 took 100 patients with confirmed knee osteoarthritis and split them into 2 groups. One group received castor oil capsules 3 times daily for 4 weeks. The other group received diclofenac sodium, a widely prescribed NSAID commonly sold as Voltaren, also 3 times daily for 4 weeks. After 4 weeks, researchers evaluated both groups on pain reduction, joint function, and safety markers. The result? Both groups showed statistically significant improvement in knee osteoarthritis symptoms. The castor oil group performed comparably to the prescription drug group. And here is the critical part. The diclofenac group reported a range of adverse drug reactions, including gastrointestinal issues. The castor oil group reported 0 adverse effects. Not reduced, 0.
That study has been cited in medical literature and used in academic comparisons of alternative arthritis therapies. It is not a fringe finding from a naturopathy blog. It is indexed in PubMed. It has been replicated in additional research. And yet, if you go to your doctor tomorrow and say you've been using castor oil on your joints, most of them will either shrug, dismiss it, or have no idea what you're talking about. Not because they're bad doctors, but because medical education is largely funded and shaped by the pharmaceutical industry, and castor oil does not generate pharmaceutical revenue. Nobody gets a commission for recommending a $2 bottle of oil. Now, let me walk you through exactly how to use this, because application method matters significantly. The most effective topical approach is what is commonly called a castor oil pack, and the science behind why it works topically is just as interesting as the clinical trial. When you apply castor oil directly to the skin over a joint, the ricinoleic acid penetrates the skin and reaches the underlying tissues. It does two things. It interacts with pain receptors in the skin and tissues called TRPV1 receptors, the same receptors involved in heat and pain signaling, and reduces their sensitivity, which means your brain receives a weaker pain signal. And it increases local circulation and lymphatic drainage around the joint, which helps flush out the inflammatory byproducts that accumulate around damaged or arthritic tissue and drive continued pain and swelling. Here is the exact method. You need cold-pressed castor oil. Look for the hexane-free variety, which you can find at health food stores, pharmacies, or online for $5 to $10 a bottle. You take a small amount, roughly 1 to 2 tablespoons, and warm it slightly by placing the bottle in warm water for a few minutes. Then apply it directly to the painful joint, a knee, a hip, a finger joint, a shoulder, and massage it in using firm circular motions for 3 to 5 minutes. The massage itself is part of the mechanism because it drives circulation and lymphatic movement. After massaging, cover the area with a piece of flannel cloth or a thin towel. Apply a warm compress or heating pad on top, low setting, for 45 minutes to 1 hour. The warmth enhances skin penetration and increases blood flow. Then remove and wipe the area clean. Do this every night before bed.
Why at night? 2 reasons. First, when you are lying still, the oil has time to penetrate without being wiped off or diluted by sweat. Second, most people with joint pain experience their worst stiffness in the morning, a phenomenon caused by inflammatory fluid accumulating in the joint during inactivity overnight. Applying castor oil in the evening while the joint is at rest allows the anti-inflammatory compounds to work on the tissue during exactly the period when inflammation tends to peak. Users who have adopted this routine consistently report reduced morning stiffness and improved joint mobility within 2 to 3 weeks of nightly application.
I also want to give you the honest picture here, because the goal is not to oversell this. Castor oil is not a cure for arthritis. Nothing applied topically reverses structural cartilage damage that has already occurred. What castor oil addresses is the inflammatory component of joint pain. The swelling, the stiffness, the ache, the sensitivity. For people with moderate to severe joint destruction, it may provide meaningful symptomatic relief, but will not rebuild cartilage or reverse bone changes. It works best as part of a broader approach that includes maintaining healthy weight, staying physically active, eating an anti-inflammatory diet, and working with your doctor on any structural issues that need medical attention. It is a tool, a highly effective, low-cost, zero-side-effect tool that most people with joint pain have never been offered.
Now let's talk about the financial picture, because this connects to something much bigger than one oil. According to the CDC, arthritis costs the United States a minimum of $81 billion in direct medical costs every single year. Medical care and lost earnings related to arthritis combined top $300 billion annually. That is more than the annual economic cost of cancer, more than tobacco-related health costs. Osteoarthritis alone was the second most costly condition treated in U.S. hospitals, accounting for over $18 billion in hospitalization costs in a single year. The pain management drug industry in the U.S. is projected to be worth nearly $45 billion.
This is one of the most profitable disease categories in all of medicine. And the business model depends on people not knowing that a naturally occurring fatty acid in a $5 bottle of oil, one backed by published clinical evidence, can provide comparable relief to a prescription medication with no side effects and no recurring prescription cost.
Here's what makes this particularly striking. Diclofenac, the drug that castor oil matched in that clinical trial, is sold under the brand name Voltaren. A tube of Voltaren gel, which is the topical version commonly used for joint pain, costs $12 to $20 for a small tube. People buy it repeatedly, every month, for years. The active pharmaceutical mechanism is blocking prostaglandin production via COX-2 inhibition. The ricinoleic acid in castor oil targets the same pathway. One product is a patented pharmaceutical compound with a marketing budget and a brand name. The other is a naturally occurring substance that has been used medicinally since ancient Egypt, costs $5 a bottle, and lasts months. The comparison is not even close on a cost basis, and the side effect profile favors castor oil overwhelmingly.
There is also a population that benefits from this more than almost anyone else, and that is older adults. Among people 65 and older, arthritis prevalence is dramatically higher. The CDC reports that adults over 65 have more than 6 times the prevalence of arthritis compared to younger adults. This is exactly the population that is most vulnerable to the gastrointestinal and cardiovascular side effects of long-term NSAID use. It is exactly the population least able to afford the $12,000 to $36,000 annual cost of biologic arthritis drugs. And it is exactly the population most likely to see meaningful quality of life improvement from reducing joint inflammation enough to move more freely, sleep better, and maintain independence. A $5 bottle of cold-pressed castor oil and a heating pad they probably already own.
So here is your action step from this video. If you or someone you love is dealing with regular joint pain in the knees, hips, hands, shoulders, anywhere, try this protocol for 3 weeks. Cold-pressed castor oil, applied to the joint, massaged for 5 minutes, covered with a warm compress for 45 minutes, every night before bed. Track how your morning stiffness changes. Track your range of motion. Track your pain level. You are not replacing your doctor. You are not stopping medication without medical guidance. You are adding a zero-cost, zero-risk, scientifically supported tool to your joint care routine that the $300 billion arthritis industry has no incentive to recommend to you. Share this video, because I guarantee someone watching this right now knows someone whose life would change if they knew this existed.